Carol wants to know, she says, this is an injury question actually. She says that she got something in her eye, went to a walk-in clinic and was given medication for 12 days. Nothing got better, so she went to an eye doctor and was sent to a surgeon, and ultimately she says she had to have her eye removed because the medication that she was initially given was not strong enough. Can she sue that walk-in clinic that she initially went to?
Well, sure. I mean, absolutely. I mean, that's the question we get all the time. Can you sue? Well, sure. You can sue for any reason at all. And now, whether you're going to be successful, that's a whole nother ball game. And so what you have to prove is that that clinic that she went into to begin with, that they breached the standard of care. Now, what does that mean? Breaching the standard of care means that you go into a medical facility that did something or did not do something that a normal and a like facility would have done or should not have done. And so just because you have a bad reaction to a otherwise, normal procedure, I mean, people go into surgery all the time, unfortunately, and they have a bad result. They lose their leg or they die or, whatever. But you have to show that the damages and the injury was caused because the that the medical provider did not, that he or she did not do what they should have done, or they did something completely that they shouldn't have done. And so just because you have a bad result, and unfortunately, I mean, I hate it. I mean, someone lost an eye in this case, but you have to prove that that person or that facility did not do what they should have done. So what I would say is seek the advice from a lawyer who does that type of work. Let he or she, I'm talking about a lawyer, let them look at it and see if there, might be a case. These are extremely difficult cases to show negligence on the part of a medical provider, but they're not impossible. And so get someone to take a look at it. Remember, the statute of limitations in the state of Alabama is 2 years. And so go ahead and get someone to take a look at it immediately. It will not cost you at all, it won't cost you anything for a lawyer who handles these types of cases to take a look and see if there's a case or not.
Well, and so if they didn't prescribe the medication that was supposed to be, say it's, it's supposed to be at one level and they went below that level, it wasn't strong enough, wouldn't that be breaching the standard of care for her particular ailment if it's recommended that you prescribe at one dose and you don't prescribe that, for it to be strong enough to be effective? Or it might have been, some kind of mistake in the translation of what the dosage amount that was prescribed. I mean, there's a lot of things that could have gone wrong, but I mean, isn't there still the possibility that there could be a case there if the medication that was prescribed wasn't what it should have been?
Oh, no, you're 100% correct on that. And so but again, it comes down to the medical records. It comes down to what was said. We get a lot of cases that, people come in and they say the doctor did this or another doctor, the second doctor. A lot of times we have people come in and say, well, the second doctor said that the first doctor didn't do this or they didn't do that. And they are 100% on our side. And then you get involved in a case and then you talk to that second doctor and they say, well, we didn't quite say that. And so, a lot of times it's hard to put, complete responsibility on